That takes you on to the next deputation, which is from the Young Communist League Edinburgh branch in relation to item 8.16, the motion by Councillor McFarlane.
Yes, thanks very much for coming along today. We very much look forward to hearing what you have to say. You have around 10 minutes to make whatever case you want, and then there'll be an opportunity for members of the council to ask you questions. So the floor is yours. Thanks very much for coming.
Yeah, I'd like to thank Council for allowing me the time to speak. My name's Dan, I'm the Secretary of the Edinburgh branch of the Young Communist League, but I'm also here, more importantly, as a concerned constituent of Edinburgh, furthermore a member of the working class, the class of people whose livelihoods and futures rise and fall on the basis of decisions made here in this room. So I'll be speaking on motion 8.16 regarding the prevention of drug-related deaths. We're talking about drug deaths, but what I'm here to talk about is how it's a class issue and must be addressed as such by Council. When people die in the street due to overdose, how often is it a wealthy landlord or a CEO, and how often is it a disenfranchised worker? I welcome and support the motion put forward by Councillor McFarlane as a first step in the marathon of tackling the issue of drug deaths. This motion could save lives. It could contribute to the creation of a culture where drug addiction is seen not as a criminal issue, but as a medical one. This motion is not without its faults, however. The view to train door staff and train licensed premises to administer life-saving drugs like naloxone reeks of a not on my property approach to drug deaths, an approach which forces already overworked people to take on further responsibility. But indeed, most importantly, this motion does not address the root of the problem. You claim to have a proactive approach. That's certainly the goal laid out by most parties sat here. But what is proactive about stepping in only when someone's life is on the line as they overdose? The proactive approach would be to address the root cause, which is poverty and deprivation. A Home Office report in 2014 concluded that there was, quote, no obvious relationship between the toughness of a country's enforcement against drug possession and the levels of drug use in that country. Drug use must be viewed as a medical issue, not a criminal one. That conversation's been had. We must now ask ourselves a 120-year-old question: what is to be done? What we need is a safe consumption facility, or safe consumption facilities in Edinburgh. Places where those who suffer from addiction can go to safely administer drugs in a supervised, sterile environment. The term gateway is often thrown away and thrown around in these conversations around drugs. But with trained professionals standing by, these FCFs absolutely will be a gateway to access homeless accommodation, a gateway to start therapy, a gateway to a new life. And Portugal, one of many countries where these facilities have been successfully implemented, they saw 776 overdoses in 1 year, but not a single death, because with medical professionals on hand, everyone was kept safe. Further, the provision of clean needles reduces the prevalence of bloodborne disease, particularly relevant in a city which not so long ago was known as the AIDS capital of Europe due to its drug issues. You claim to want to reduce harm. Again, that is the mandate on which everyone sat here today was elected. This is how we do it. A common idealistic criticism of SCFs is that their presence can cause an issue for both law enforcement and local residents, with a rising crime and encouraged drug use. However, in 2019, the Scottish Affairs Committee reported that there was, quote, no evidence that these facilities increase injecting, drug use, or local crime rates. These facilities also offer homeless drug users access to medical services they mightn't otherwise get, as it's more difficult to without a fixed address. I ask you to support this motion, but I further ask you to deliver on past promises. Will the Green candidates deliver on their 2022 manifesto promise to tackle the drug-related deaths, quote, with a focus on drop-in services, including drug consumption rooms and crisis centres? Will the Lib Dems deliver on their 2021 and 2022 manifesto promises to, quote, help establish heroin-assisted treatment and safe consumption spaces, and to, quote, treat drug misuse with compassion. Will the Labour councillors, those who were elected as representatives of the working class, and indeed the other Labour councillors who still sit in the Labour group, deliver on their 2021 pledge to, quote, support the adoption of safe consumption rooms alongside expanded community resources that help people avoid substance misuse in the first place? Will the SNP, in accordance with their 2021 pledge, remain committed to the introduction of medically supervised safe consumption facilities and, quote, explore every legal avenue to establish them in Scotland? I call on Council not only to support this motion, but to speak to your party colleagues, MPs and MSPs, work with them to fight for change, create a financial plan for the implementation of an SAF in Edinburgh, start the legal battle for SAFs, fight like lives are on the line, because they are. Show the working class your vigour. Prove to us that when the election ballots close, your colours do not turn to blue. Save lives, save money through safe consumption.
Thanks very much for that really well-researched contribution. Questions from members? I see Councillor Kate Campbell first.
Thank you, Lord Provost, and thank you, Dan. I don't think there's a single word you said that I disagreed with. That was one of the most powerful deputations that we've had, and I really appreciate you taking the time to come and speak to us today. Having said that, I agree with everything. Would you have a meeting with me and any other councillors to see what we can do? Because I think you've got a lot of ideas and I'd be really keen to see what, obviously some of this has to be done at other places at Parliaments, but what we can do here, I would be more than happy to engage with you and see how we can push that forward.
So this is a campaign that the Young Communist League are striving to escalate until we get a safe consumption facility, and we will work with any elected official who is willing to help out in assistance with that.
Thanks very much. Councillor Leslie Cameron.
Thank you, Lord Provost, and thank you for your deputation. I'm not sure if you'd have a chance to see the Labour Group amendment to the motion that's in front of us today, where it sets out a series of measures. For your information, I am an active supporter of the Labour campaign for drug policy reform, so I'm very, very keen to, and that's why I've put forward the amendment. So would you be willing to participate in an Edinburgh-type summit? I mean, Councillor Kate Campbell has asked if you'll meet her, but what we are proposing from the Labour side is to have a kind of review on where we've got to. And I also was wondering if you'd already or planned to respond to the consultation that's currently underway by Paul Sweeney MSP on his proposed bill on preventing drug deaths, whether you'd already done that, and if so, could we have sight, or would you be happy to share your comments to that consultation, please, with the Council, not just with me, but with members of the Council. Thank you. Thank you, Lord Provost. We would be willing to work with any wider summit in order to achieve this. Obviously our goal is simply to have a safe consumption facility in Edinburgh, and we wouldn't let sectarian lines come between us and an actual material improvement for the working class. As regards a more recent consultation, I don't have any comments just now.
Thanks very much. Just on my list at the moment, I have Councillor Amy McNeese-Meehan, Councillor Alice Mumford, Councillor Pogson and Councillor Mackenzie. And now Councillor Davidson. That will probably take us to the end of our 10 minutes, I think. Okay, so Councillor McNeese-Meehan.
Thank you, Lord Provost. How supportive are the League of fully devolved drug policy that would mean that trauma-informed staff are there, fully trained trauma-informed staff are there in all of the safe consumption facilities as well?
If I'm understanding the question correctly, apologies if I misheard, we of course would want full power for the medical professionals in these services to be able to do whatever is required to help out. if that's what you're asking.
Thanks very much. Councillor Mumford.
Thank you, and thanks so much for that again, to echo the comments. It was really powerful and a really vital topic. And as you mentioned, we Greens do fully support safe consumption facilities. So I wanted to ask, particularly on that, you mentioned that it's a campaign you'll be working on. Are there other groups that you are working with on this that are already doing sort of work in the community that would be helpful for us to reach out to as well? And do you have a proposed location in mind for Edinburgh's first safe consumption facility? Thanks.
Thank you for your words. We are again happy and indeed inviting other groups who may be interested in developing such a safe consumption facility. We don't yet have a campaign which has reached out to these wider groups, but that will be something that we aim to do. As regards proposed location, there are a few. Obviously, the primary goal is to have these in places where they would be most effective, particularly the more deprived areas of Edinburgh. As regards specific locations, we don't have that. That is something that I believe should be tasked to Council to recommend. Now, that being said, once this campaign develops and escalates further, I'm sure we will have specific recommendations.
Thanks very much. Councillor Pogson.
Yes, thanks very much for your deputation. As well as the tragedy of all the drug deaths that we're here discussing this morning, I'm also aware of the equal tragedy of deaths within the homelessness system. And I understand there's a degree of connection between these two lists, unfortunately. And I'm just thinking about, treating the whole person or meeting the needs of the whole person. So, the individuals that we're talking about here, they will have housing needs, circumstances within their lives as well. And you talked about that, meeting the need at the point of crisis, which is way too late, and actually working with the individual as a whole and their needs much earlier in the process. And I just wondered if you had any experience amongst your members around that sort of tie-up with housing need and homelessness, and any thoughts on that. Thanks.
Yeah, thank you for your words again. So as regards dealing with these issues, which are of course related, all issues facing the working class are of course related, and they all come under the same umbrella, which is class. These are how all these issues are linked. It's an economic fact of life. The way we would look to do to address these issues simultaneously would be to, in these safe consumption facilities, have not just medical professionals trained, but also have other services available to them, as I say, like counselling, therapy, and also support through something like the Citizens Advice Service, where they can begin to access information and start the road to whether it's gaining actual fixed accommodation or addressing any other issues which they might face. As regards our experience, none of us are necessarily trained professionals in any of these aspects, but many of us are indeed heavily involved in community organisations, particularly with regards to the Housing Living Rent as an organisation which I believe almost all of us are heavily involved in and supportive of. Again, these community organisations which build power from the ground up are absolutely instrumental in allowing us to address issues which are faced by the working class. And these indeed would be the types of organisations that we may invite to help out with such a campaign to broaden the scope, so to speak.
Thank you. Councillor Mackenzie.
Thanks for the deputation. It was very powerful, as Heather has said, and thanks for highlighting this as a class issue, which I think is particularly evident in Edinburgh, where many people, I think, can go about their lives around the centre and the near periphery without ever coming into contact or having any sense of the drug problem that exists in other areas of the city. But it's another class issue that's going to dominate this chamber over the next 5 years, and it's the attack on the working class that comes from the enormous cuts to this council that are coming from the Tories at Westminster and then also from the SNP and the Greens at Holyrood. And in that context, I wondered if you could give us some idea as to how much you think a safe consumption centre would cost.
Yeah, no, very prevalent and important question in this. Money, of course, is an issue in everything we're doing, and I totally agree with what you're saying, that it is disappointing to see cuts happening across the board. In terms of finance, the UK Advisory Council for the Misuse of Drugs concluded that SCFs save more money than they cost due to the reductions in deaths and HIV infections that they produce. So ultimately, these things pay for themselves. And indeed, as I say, Edinburgh was known as the HIV capital of Europe not so long ago. The prime cause of HIV in Scotland is the use of unclean needles. The average lifetime cost of treating someone with HIV in Britain is roughly 360,000 per person. So we estimate, by taking into account these costs, which are incurred as a consequence of problem drug use, and as well as just healthcare, but criminal justice, social care, and wider costs to the economy or society. Problem drug use in Edinburgh costs over 500 million a year. Glasgow City Council Integration Joint Board, reported that the cost of an SCF and a separate heroin-assisted treatment would cost £2,350,000 a year. So if you're losing £500 a day, and I can point to a very clear evidence-based way you could solve it for £2.35 a day, I think it's a bit of a no-brainer financially, and I don't think you have to have any sort of degree in financial risk assessment to come to that conclusion.
Thanks very much. And final question from Councillor Davidson.
First of all, I want to thank you for the deputation. It was really powerful. I wondered if you'd had a chance to see the Lib Dem addendum, which is calling for an overdose prevention centre here in Edinburgh, because I think we've talked a lot, we've had many summits and discussions, but we know what works, safe consumption rooms. So do you agree we need more urgent action than just talking?
Yeah. Sorry, can you repeat the question?
Do you agree we need more urgent action than just talking? Our amendment's calling for a trial to be started as soon as possible.
Yes, absolutely. I'm here to absolutely essentially demand that councillors do more than just talk. And indeed, of course, we all want to work to achieve these. I think a trial safe consumption facility, if that's what you're implying, would definitely be a good start. And I think that's, certainly, as I say, a gateway to allowing such facilities to proliferate across Scotland and hopefully across Britain. So that would be something we support. Obviously, it still depends on the context and the actual specifics of such a thing. There could potentially be examples of trial which we may not support because we may feel it doesn't accurately represent the type of safe consumption facility we would be striving to have, and may ultimately mislead on what this campaign would be about. But generally speaking, yes, a trial safe consumption facility would be something that we would be in favour of.
Okay. Well, thanks very much, and thanks very much for that very articulate deputation. It's excellent. So thank you very much for food for thought. What is going to happen is I'll invite you to leave the meeting very shortly, but we will have a short break then until around 11:05, and we'll then debate the three motions that there have been deputations about immediately after that. So you're very welcome to stay if you wish in the public gallery, or if you'd rather watch it online, it will be webcast live as well. But thank you very much for your deputation.